The Royal Australian and New Zealand College of Radiologists advances best practice across clinical radiology and radiation oncology. Our college is recognised internationally as a world-class provider of postgraduate medical education. The college currently has 141 accredited clinical radiology training sites and 52 accredited radiation oncology training sites across Australia, New Zealand and Singapore. The college also assesses international medical graduates, or IMGs. Each year, about 20% of new fellows are IMGs. Following a comprehensive review of the college's training programs, a group of dedicated members, trainees, other medical specialists, educationalists, consumers and college staff worked together on a project to improve our training programs. The changes will be implemented in December 2020 for New Zealand and February 2021 for Australia and Singapore, and aim to ensure our training programs remain an exemplar of current best practice in medical education.
The college commissioned a review of our examination and assessment processes by the Australian Council for Educational Research and Emeritus Professor David Prideaux. The recommendations out of that review have formed the basis of our training and assessment reform program. Many of these recommendations have already been implemented, particularly around our examination processes by way of improved examiner training, blueprinting, standard setting of our exams, marking rubrics and improved examination feedback. Other recommendations will be implemented as part of our training and assessment reform program, which rolls out in 2021.
The review is a quality improvement initiative. We know our existing training program is good. With regards to the curriculum document, some sections have had minor tweaks, other sections have been expanded and new content added. For example, there's a much more expanded section on palliative care and symptom management and also cultural competency. The layout also reflects patient-centred care.
The curriculum is better structured and more streamlined. We've done a lot of work to ensure that the format and the terminology within the curriculum is more consistent. The intrinsic role learning objectives have been expanded, and we've included learning objectives in relation to cultural competence. The college is excited to include artificial intelligence for the first time in our curriculum, as radiology has always been at the forefront of technology in medicine. While we continue to recognise the importance of summative examinations, we're incorporating programmatic assessment into our training program. This will enable us to capture multiple data points on a trainee's progress across a variety of settings and a variety of assessors.
So quite big changes in the exams. I think that some of the biggest things will be with the new programmatic assessment in the enhanced training program. We can incorporate the trainees' day-to-day work and ongoing assessments into the overall assessment rather than relying just on certain examinations as the key training points. Finally, you'll have the vivas as sort of the end point in the final examination assessment of the whole program.
The Entrustability scale is a measurement tool for measuring at what level a trainee can practice safely and independently. It spans 4 levels of competence, which is aligned with the level of supervision a trainee requires. It's okay to be at level 1 early in your training, where the trainee may require full-time one-on-one supervision, but the trainee is expected to progress and improve over time. The level of supervision should decrease throughout the training program. So it allows clinical supervisors and directors of training to identify areas of concern with a view to providing more support to improve performance as soon as possible.
The new assessment tools are much more practical, they're easy to complete, and so it means that supervisors can provide more timely feedback to their trainees and also monitor their trainees' progress more readily than we could before. The Oncology Sciences workshops are designed to replace the old clinical assignments, and they've been piloted through a number of networks already and have had universally positive feedback from the trainees. Their interactive nature means that we're able to really discuss complex topics very well. Overall, they've proven themselves to be a very useful learning tool, but crucially, they're also not very onerous on the facilitators and the organisers. The new work-based assessment tools will allow supervisors to observe trainees in the workplace and to assess their performance in a clinically relevant context.
So it's been really great to see that the trainees' voices have been heard in regards to making the new training program a bit more relevant to today's time. So the new planning and contouring assessment tool is really good at assessing the variability in training, teaching and assessment of planning across all the different training networks. So as trainees, we should take the responsibility to ensure that we have undertaken all the trainee requirements and assessments, but we still have the guidance and feedback from our supervisors to ensure we're on the right track.
We understand that every trainee's journey through the training program is different and that they all learn at different rates. The Enhanced program will provide additional opportunities and milestones and mechanisms so that they can get the support that they need during training. The college is grateful for all those who have contributed their time and their invaluable input to this project.
I guess we as trainers and the trainees themselves have one goal, and that is to ensure that our trainees at the end of the program are capable of safe, competent practice on their first day of independent practice. And we believe that the training program we've developed will support them in achieving that goal.